I'm a retired educator, taught school in Aurora for 42 years, and me as a biological sciences instructor, always paid attention. We had health fair blood work drawn every year for quite a few years, So I thought, for the most part, all my blood work and that, I thought we were in pretty good shape.
We were in Gothenburg because my mom was sick and in the hospital. Dick was having lunch with our brother-in-law and nephew and wife.
We're having a nice little sit-down dinner, and all of a sudden, it happened. I felt my left side kind of go numb, and that I had no control over it. And then I dropped a glass when I went to get a drink of pop. And then, of course, I dumped the whole glass off the table, and onto the floor.
There was an EMT guy there who happened just to be eating lunch and knew what was happening, so he knew that it was a stroke right away.
And the next thing I know, I'm on this gurney, and he's putting an oxygen mask on my face, and I see the doorway.
He could not speak. He was aphakic. He had pretty significant weakness on the left side. Probably most important, we knew exactly when the symptoms started. And so that really sets us up to start evaluating him for using TPA.
There really is not a substitute for it as far as medication. Patients that have ischemic strokes, less than 10% actually end up getting TPA. And the problem is that there's kind of a sweet spot. It needs to be given. The best time is within 3 hours, and so many patients don't come in quick enough.
Basically, people think of it as a clot-busting medication, so it's a really strong medication that we can use to decrease symptoms of stroke and sometimes heart attacks as well.
One of the challenges of rural healthcare, say in the emergency room, we don't have a team of specialists here on site backing up our providers. They have to know a little bit of everything, and they have to be very generalist, so they have to be able to diagnose, but then they also know that they need to be able to make a phone call and find that right specialist, find somebody that they trust, somebody that they can really believe in to be able to make the right call for the patients and to get the patients where they need to go.
We called UNMC, and I talked with one of the neurologists there, and we kind of went through the checklist that we have, which I use every time. If I have a patient I'm going to look at for TPA, and he agreed that we should use it, so we went ahead and confirmed the dose and gave him the medication.
She said, "We're going to life flight you to the med center." And I asked why, and she said because Dick's clot was fairly big, and the med center has the capability of doing surgery and pulling it out, which then makes your recovery better if you get rid of that clot. When we got into Omaha, he talked better. He could answer their questions, and they said the TPA had done its thing. The surgery was off the table. They no longer had to do the surgery.
I've always felt like living in a rural area should not be something that you have to compromise what kind of care is available to you.
We enlisted the aid of the American Heart Association and got the representative for the company that makes it also to come in and talk with our providers and put them a little more at ease with giving it. We got the availability of putting it in-house, putting it in on consignment. So there really was no reason not to have it. You think of all the medical bills for the rest of their life. If they're, partially paralyzed, all the help that they would need, all the medical expenses would be huge. So this one dose of TPA would be just a drop in the bucket.
Strokes and heart disease are common everywhere, and they're common here, and I'm glad that it's a priority.
I've got a friend that's a retired hospital administrator here in town, and I play a lot of golf with and that. And he said that you're lucky because there are a lot of small community hospitals that don't have CT scan, they don't have the TPA. Not everybody's got those. So he said you were pretty fortunate that way.
It was because of Gothenburg's good care that we had such good outcome.
Had a lot of people that were very caring. Yeah, we were lucky, very fortunate, very blessed.